Good afternoon and welcome. On behalf of ADEA, thank you for your interest in the 2020 Academic Dental Careers Fellowship Program. This session is being recorded and will be made available on adea.org. You are welcome to submit questions throughout this brief presentation, and I will answer them at the end. Please type your questions using the questions feature. My name is Susan Apollonio, and I'm the Senior Director for Educational Leadership and Faculty Development Programming. And again, welcome to the 2020 ADCFP Overview webinar. The purpose of the ADCFP is to connect dental students or fellows with faculty mentors to provide students insight to the day-to-day life of faculty education or educators or researchers. It is a voluntary program offered by ADEA and managed by each individual dental school. ADEA's goal is for every dental school to offer the program. And to that end, it is intentionally flexible by design so as to meet the goals and needs of individual participants. Since its inception in 2006, more than 400 students at 36 dental schools have completed the ADCFP, and ADEA's goal is to have every school participate in the program. The program objectives for students is to provide an opportunity to explore career pathways within academic dentistry, professional training specific to teaching and research, and to expand their peer and professional networks. Additionally, it is to enhance engagement with their faculty. For faculty, institutions, and mentors, this program seeks to increase institutional capacity to develop the pipeline of students interested in academic dentistry and to support faculty efforts to foster a collaborative culture of teaching and research excellence. I'd like to share more information on the participant roles and how they interact to meet the program objectives. Each individual dental institution elects a coordinator or a liaison, and some schools elect multiple liaisons. Each dental institution needs to recruit faculty-student mentor pairs to begin the program in May 2020. And in years past, schools have had anywhere from 1 to 23 faculty-student mentor pairs. In a collaborative effort, the ADCFP liaison and faculty mentors provide a positive and engaging experience for student fellows while simultaneously creating a hub for all students interested in pursuing academic dental careers. Let's look a bit more closely at the program participants that we have mentioned thus far. The role of the ADCFP liaison is to serve as the primary contact with ADEA, convey issues that arise or programming that would be beneficial, as well as to serve as the ambassador of the program objectives at the institution. The liaison is definitely not a manager of the faculty-student mentorships. Those detailed interactions between the faculty mentor and student fellows is the responsibility of those individuals. However, liaisons are required to attend the 2020-21 ADCFP training during the annual session. If the faculty liaison is not able to attend, then another faculty member should do so. The training session for the next year of ADCFP will be held on Monday, March 16th during the annual session. After the mandatory training, it is the responsibility of the faculty liaison to ensure that the communications from ADEA reach the faculty mentors and students as appropriate. ADEA will send informational PowerPoints and other items of interest to ADCFP faculty mentors and students, which the liaison should then forward on. And again, after the mandatory training, it is the responsibility of the liaison to arrange at least 1 to 2 informational sessions to answer questions from interested participants at their home institutions. Additionally, ADEA will request information from liaisons throughout the program year about participants in the program. So faculty mentors work directly with the student fellows. They co-create the action plan with the fellow, and I'll talk a little bit more about this in a few minutes. The faculty mentors meet with the fellows at least twice a month, ideally in person or virtually, and they provide the fellow mentorship and logistical assistance with teaching or their research projects. The faculty mentors manage the fellows' progress in ADCFP and provide feedback throughout the year about their work. Faculty mentors might be individuals who exclusively teach a lecture-based didactic or clinical course, or they might be exclusively involved in clinical instruction. Faculty mentors might be involved in conducting clinical education or biomedical research, or they could put the student in touch with a faculty member who can support that aspect of the program. And now I'd like to move on and talk a little bit about the student fellows. At most institutions, ADCFP student activity is generally from May to December, and then the student works on their final project from January until the ADEA annual session, usually in March. However, some institutions align the ADCFP program with their specific academic year or the calendar year, and that is perfectly fine as well. Again, by design, the ADCFP is meant to be flexible and customizable to meet the needs of the student fellows. So, which students are eligible? Any student in their predoctoral education in predoctoral dentistry, allied dental students at a dental institution, and advanced education students who are interested in learning about academic careers in dentistry, such as teaching or research, are eligible for the ADCFP. Usually, the student fellow identifies their research interest in a teaching track, either educational or clinical research, or a student might be interested in a biomedical basic science research track. If this is the case, then the student's research project would be a basic science-based project. Typically, institutions create an application or utilize the ADEA sample application for interested students to apply to the program. ADCFP applications can be used to collect information about the students, or it can be used in a competitive manner to rate applicants and determine entry into the program. Every school takes a different approach to this, and that is fine. But whatever format, schools are strongly encouraged to have some sort of application process. So on this slide, you can see some of the program components that have been recommended and have typically been utilized at most of the ADCFP programs at dental schools around the country. Fellow and faculty mentor pairs design their own unique experience utilizing these program components, and they are welcome to choose some components or design their own projects. ADEA does recommend that at a minimum, each student fellow meets with their faculty mentor twice monthly and that they complete their project action plan early in the course of the program, most often by May, to ensure that the goals and outcomes are clearly defined in the beginning. ADEA also recommends the inclusion of reflection papers as a component if the program each student completes a scholarly research project. And I'd like to spend some time talking about each one of these elements. And again, the faculty mentors and students can design their own programming utilizing some or all of these. So the action plan. This plan is basically a brief description of the final culminating poster or research project, a preliminary timeline to complete the project, as well as the other professional and personal goals that the fellow plans to achieve. Fellow and faculty mentor pairs have latitude in designing their own program to meet the fellow and mentor goals. And here you can see a sample of what should be included in that action plan. Typically, they include the fellow's personal objectives for the year, the schedule of the mentor-fellow bi-monthly meetings, due dates for the first career reflection essay, a roster of faculty that might be interviewed, a list of fellows' teaching assignments, research project descriptions, and other activities planned to achieve objectives. Action plans are usually due in May or June, or very early in the program cycle. And examples of past action plans will be shared during the mandatory training at the annual session in March. So a little bit about the objectives. Usually the fellow identifies 2 or 3 objectives that address questions such as, what will be the experience that will define the program? What are my personal goals? And how will I measure them? The objectives might center around teaching activity or a biomedical research project. Some examples of a teaching activity might be to develop a syllabus, course objectives, a lecture, or a lunch and learn for students. Or they might develop an assessment tool of some kind. Research practicum examples might include designing a new project or working on an existing faculty project that their faculty mentor is already in progress on. Or again, a lunch and learn for students. And a question that we are frequently asked is, can a student have more than one faculty mentor to help them achieve whatever their specific goals might be? And the answer is absolutely yes. So bi-monthly meetings, these are the most crucial aspects of the program, and no matter how busy the student and faculty might be, meetings should never be canceled. They may have to be occasionally rescheduled, shortened, or switched to a virtual format, but never canceled. Meetings should occur at a minimum twice per month, and again, ideally in person rather than virtually. The meeting should be scheduled for at least 30 minutes, and the fellows should prepare questions prior to the meeting. And again, these are really important aspects of the program, and every effort should be made to keep to the schedule. So, career reflection essays. ADEA recommends that fellows complete at least 2 of these throughout the program, one early and one around the time that their action plan is developed, and a second with the final portfolio. However, the student-faculty pairs might decide on more as appropriate, and we'll talk a little bit more about that in a minute. The first essay might have the student fellow reflect on why they are interested in an academic career, or have them identify priorities for the professional component of their life. What are their career goals, and where does academia or research fit in? And it could also have them articulate the values and preferences and principles that guide their concept of being an educator. In the second essay, they could describe their impressions of what it is like to be a dental faculty member, identify the motivations or challenges they associate with choosing an academic career, and include reflection on how their thoughts about a career in academia have evolved during their participation in the program. So one component for ADCFP participants is to conduct interviews with faculty other than their mentor. And this could be a faculty member or administrator, a new junior faculty, or senior tenured professor, individuals focused on research, administrators like deans or associate deans, or program directors. Now on the screen is a sample list of individuals who might be interviewed by a student, and these samples will be shared during the mandatory training. And to ensure that the students are well prepared for interviews, ADEA will share sample interview questions, and the faculty mentor can play an important role by reviewing any prepared questions with the fellow in advance. ADEA also has some suggested guidelines for interviews, and those are that fellows should have a list of questions prepared before the interview. Each faculty interview should be at a maximum 30 to 45 minutes long, and that the students should draft a synopsis of each interview that they conduct. And after all the interviews are completed, fellows should write a reflection paper on the overall impressions and themes that they identified through the process. And again, ADEA will provide some samples during training. So some students may choose a teaching track. And ADEA recommends that the student has at least one teaching experience per semester. And this can occur in a variety of settings, such as a standard lecture in a didactic course, or several experiences teaching in a preclinical lab, where the student might be involved in developing and delivering a small group case, conference, or seminar experience. Or for a senior level student, there might be an opportunity for participation in a clinic setting to gain exposure to teaching in that environment. And here's how that might look for the fellow and the mentor. The fellow might develop objectives, a presentation, and handouts after receiving guidance from their mentor on topic selection. The student fellow will review objectives and the presentation with their mentor, as well as schedule a rehearsal with their mentor. The mentor can assist the student by making appropriate arrangements, guiding the rehearsal, and observing the classroom presentation. And of course, the fellows should also develop an assessment tool for their participants and for themselves. And the mentor should provide feedback and complete the assessment. So the biomedical research track. For students interested in this area, and therefore in a biomedical research area, and therefore research track, they would follow a standard description of a research project, and they should include the following: the focus and title of the research project, a synopsis of the project, including the rationale, study design, methodology, and data collection and analysis, the research questions and hypothesis, the specific student roles and responsibility in the project should be clearly stated so that there are no misunderstandings, especially if the faculty member that is overseeing the project is not the primary faculty mentor. And of course, the proposal will include the name or names of the faculty members who will supervise the student in the biomedical research project. There are other activities that support the ADCFP, and many faculty mentors and liaisons work together to develop these for the student fellows, and they are typically based on the desired outcomes of the individual student. And here are some examples, and this is not exhaustive, but it should give you an idea of what some schools have offered fellows by way of observing activities and meetings that faculty regularly participate in. A reflection component, of course, should be part of each of these observation activities, in addition to the two main reflection papers that I have spoken about already. Now, other activities can support network building in informal settings, and here you can see some examples of what form these might take. And early on, the mentor can facilitate this, and then later on, the student can take the lead. ADEA also recommends that before each student fellow completes the ADCFP, that they prepare and present a poster presentation. The poster can focus on, but is not limited to, assessment of their teaching experiences, or the poster can summarize the findings of the faculty interviews, or it could be a synopsis of their research project. Students who complete the 2020-21 ADCFP program have an option of presenting their poster at the 2021 ADEA annual session. Schools must fund the students in totality. However, this is not a requirement for completion of the fellowship. Schools are strongly encouraged to arrange a poster presentation at their home institution in an effort to share with other faculty and students the fruits of their hard work, and as an important way to excite others to participate in the ADCFP the following year. Additionally, at the ADEA annual session, there is an ADCFP reception where fellows receive a certificate of completion and get an opportunity to network with other student fellows and mentors from dental schools across the country. And the ADCFP fellowship culminates with the student fellows putting together their final portfolio. The portfolio should document all of the activities that the fellow took part in during their fellowship year, from plans and meeting logs to reflections and assessments, reports, research, and if applicable, the poster created for the ADEA annual session or presentation at their home institution. And finally, as we wrap up, I want to share some important dates of note for preparing for the 2020-21 ADCFP program year. In January of 2020, on the 24th, is the deadline for the early bird registration for the ADEA annual session. And the school faculty liaison should register for annual session by this date. And then by February 8th, 2020, schools should identify the ADCFP liaison for ADEA. And I will send out an email asking for confirmation and of training attendance, or you can email me directly, and my email will be up on the screen in just a moment. And then in the time frame of February to May 2020, schools should complete recruitment of the faculty mentors and student fellows. And then on March 16th, 2020, during the ADEA annual session, the designated representative or liaison should attend the mandatory training at the ADEA annual session. And then in June 2020, the Fellow Mentor Action Plan should be completed and everybody should be up and running with their program year. And so with that, I'd like to thank all of you for joining this webinar today. And if you have questions, you can go ahead and submit them through the questions box. I will answer them for the group. And again, this webinar is being recorded and will be posted to the ADEA ADCFP section of our website in just a couple of days. And so with that, I invite you to submit your questions. Okay, so the first question coming in is, will ADEA provide samples and support materials to the faculty liaisons? And the question is absolutely yes. When we go through the training at the ADEA annual session, we will have sample action plans and sample project types and even examples of the posters that students have put together, and we will share them for everybody to take back to their institutions. And we'll just give it another minute to see if we have any other questions come in. This next one is very similar to the last one, is about will there be handouts provided, and the answer is absolutely yes. We will give you everything you need to build your structure of the program, and you'll see quickly that based on who's in the program and serving as a mentor, that the projects and process will evolve to meet the needs and culture of your home institutions. And it doesn't look like we have any more questions coming in. So with that, I want to say thank you all again for joining us today and look forward to working with you throughout the year. Thank you.